Awesome. Okay. Now, thank you everybody for coming to tonight's event. This is a pretty exciting topic about the work incentive network. For anybody that is trying to find information about working after disability or on OHP benefits or SSI or SSDI, there's a lot of misconstrued information out there, a lot of wrong answers out there. And unfortunately, a lot of DHS caseworkers don't have the right answers. So we're super excited to have a couple professionals with us tonight. Leslie Keller and Kirsty Keller Talley are here to really give us the right information and help spread the work that they do, and also where you can reach out to and schedule a more personal appointment to get the right information and figure out what the best path is for you. So with that, I'd love to turn it over to Leslie to do her presentation. So Christy, if you want to share your presentation, that'd be awesome. Thank you. Leslie, I'll let you take it from here.
Okay, thank you, Casey. Thank you for having me. I really love doing these because it took me most of my adult life to realize that I could work and save money and do things that I didn't realize I could do. So I was in my 40s before I really had a good job. This one. Anyways, we're gonna start. So we are with the Work Incentives Network. It does span the entire state of Oregon. There are 11 of us. I'm at Hassel in Grants Pass, but the other ones are located at other CILs, which will give that information. In the chat is the information on how to get a referral for yourself, which you can do yourself, or a community partner could refer you. There's various ways to do it. And that information is in the chat. That's for the more personalized work incentives, benefits counseling. I'm just going to give you an overview of things tonight. Okay, so these are just the basic steps to benefits planning. So as I was just talking about, first you submit a referral, and that can be by the phone number, it can be by email, it can be online, it can also be done on paper. I have access to a paper form that can also be used. So there's lots of ways to do it. So after that referral goes in, that gets distributed to one of us. We are called the Work Incentives Coordinators, and it varies. If you want a personal approach, like being seen in person, you can request that when you do your referral, because some people do better in person, and we do travel to Jackson County, Josephine County, Curry County, and Douglas County. So that's just the two of us. The rest of them cover the rest of the state. So when we get that referral, we then contact you and we send out this lovely stack of paperwork that has to be filled out first, because of course, you know, as a nonprofit, we all have to fill out our lovely forms to make sure we're serving actual human beings. So that part's probably the hardest because there's so much of it. So then you fill that out, you send it back to us, and we fax Social Security to get some information about your benefits. And then we also get state and federal information from our admins that are above us. And after that is when we have a meeting with you to discuss your employment goals. If you have work history, how much of it you've worked. Some people do know more about their benefits than others, so we don't always have to wait for all of those verifications to come through. But a lot of people are really not aware of all the benefits they have. And then after we get all of that information, we write you out a report that's personalized to you, and how your earnings can affect your benefits, whether that be SNAP benefits, SSI, SSDI, CDB, all the various ones we're going to talk about tonight, including Medicare, Medicaid, all of that fun stuff. So that's just the basic overview of how it works. So the things that we would like you to have for that first meeting would be any letters from Social Security that have anything to do with your benefits or earnings if you've had them before, pay stubs. And if you happen to have verification of your benefits, like the benefit letter you can get from Social Security, that's helpful as well. And then any work history that you have is important. So first, we're going to talk about SSI, and this is personal to me because I am an SSI beneficiary, or I was. Let me explain that. So that rate is $943. We all know no one can live on $943. It's just pretty much impossible. So there are lots of work incentives that go along with SSI to allow you to make more. As we all know, resources have to be under $2,000, so saving money is not an option. These are some of the work incentives that apply to SSI. We have what's called an IRWI, and what that is that's expenses related to your disability that are paid out of pocket by you. And that number can be deducted from the number of what you earn to make that less so that your benefits can stay in place. And that's better explained when you're personal doing it. And then there's what's called blind work expenses for those that are on benefits specifically as statutorily blind by Social Security standards. That one is really cool because you can take out any expense that you have, whether that be your lunch for the day, your daycare, stuff for your dog, like if it even slightly relates to you, then that applies. So that's a really cool one.
Leslie, can I ask you a question about that last one?
Sure.
So for a lot of people attending this, like spinal cord injuries are like the main thing. So if there's any extra information you can think of that would pertain to the last slide, to the IRWE that would go along with that you could recommend, like that would be cost related, please share. And if that's more of a personal thing, then that's also fine.
It can be, but just to give a few examples, like if you needed a certain type of shoes to be on your, you could stand some and you needed them to work, that expense could be deducted from your earnings so that they don't take as much of your SSI check. It could be vitamins that you take to get you through the day. It could be any out-of-pocket expense that's directly related to your disability and allows you to work is considered an IRWI. But it does have to be directly related to your disability.
And could that be some of like wheelchair related products and stuff too then?
If that applied to you working, yes. Like if you needed certain modifications done in order to be able to do your job, yeah, that would count.
Awesome. Thanks for elaborating on that.
Yeah, no problem. Okay, and this one is mostly for, I don't know if we have anybody that would qualify for this, but this is for people who are under the age of 22. It is a work incentive that allows earnings to be excluded from their income if they are going to school and working. So if you had, say, an 18-year-old that's in the Project Youth Plus situation and gets a job, we can deduct a lot of that job. And usually that person doesn't lose any of their SSI check at all because most kids don't work more than $2,000 a month. So that one's really cool and not really known about. And then the other one is called a special condition, and this applies to anyone. And it only applies when they're determining SGA for Social Security, which we'll go into a little more detail about. But that's just a specific number. You can't be earning more than $1,550 to be eligible. But if you had, say, a job coach that was paid for by VR, that could be an expense that was allowed. You have a question?
Yeah, I was curious for the under 21, does that include like if they're in maybe like freshman year of college?
Yes.
Thank you.
Yeah, no problem. And it's all the way up until the day before your 22nd birthday. Just so that part's clear. But yeah, this special condition has to do with like having on-the-job help that's paid for, say, through another agency that can be deducted and allow you to earn more and keep more of your check. And that's on a case-by-case situation, but there are definitely a lot of different things that qualify for that. This one is the one that applies to me. I have worked so much that my SSI check has gone to zero. So I have not received a check in a couple of years. However, because I am under 42,955 a year, I still keep my Medicaid, which is really awesome because it's the most important part of my benefit. It pays for my chair and everything else. So I wish I had known that work incentive existed a long time ago, because a lot of people don't realize that it's there. And if you go over that threshold, for instance, I'm getting very close, I'm hoping. When you go over, there's what's called the employed persons with disabilities that you can pay into. And the countable income is listed there of what you can, depending on what you make, depends on what you pay. So once you go to that, your resources go up to $5,000 and you become a household of one. So if you had a spouse that wanted to work, at this point, they could work and not affect your benefit at all. So that's part I'm looking forward to. So my husband can make money and not affect me.
And Leslie, the 2832 and above, is there a cap on how above?
That's a good question. It's not always clear, but we believe, based on all the research that we've done and admins have looked into it, that it's close to 6,000. Is that correct? Is that what we found? Like 5,800 and something, but they're not really forthcoming with that cap. So I think it's a bit of a gray area.
Got you. And so just to be clear, what if people started working and making more, they would talk to their DHS caseworker about the EPD program?
You could, or you could come to one of us.
Okay, awesome. And then
Yeah.
that would allow them to make up to these figures here and still keep their Medicaid benefits.
Yes. And,
Awesome.
and the resources go up and you become a household of one. So
very cool. And that's so important for people that receive care hours, because there's private insurance that pays for care hours. So it's such like a mind boggle, worrying about losing care hours, even though you want to work, have the ability to work, but you still need those care hours. So this is actually a really cool program.
Yes, I definitely agree with that.
Leslie?
Yes.
This is Marcia Wenzel. If you have from Social Security SSI and your income goes down to zero, does that take you off of the Social Security programs and make you like a free floating in space? And if you needed to, if you couldn't work anymore, would you be able to go back to Social Security, or have you cut your umbilical cord?
No, actually, if you worked completely off of Social Security, completely off of SSI, there is what's called expedited reinstatement. And that just means you don't have to go through the whole application process again. And that's if you're completely off benefits. Like in my case, I've been down to zero for a couple of years, but if my income suddenly went back down, I could have my SSI reinstated.
Would this be true for SSD?
Yes.
Wow.
Yes, they also have it's a 5-year window after you go off of benefits. If something happens and you determine you can't keep that level of work anymore, you can put in for expedited reinstatement, and it's supposed to give you payments while you wait for their decision, because they still go through this decision process for the Social Security, but at least you don't have to reapply completely and start over.
Why don't people know this?
This is why my job exists.
Bless you.
Yeah. Unfortunately, there's not a lot known. So now we're going to go into Title II. This would be your SSDI benefits, your CDB benefits, and your DWB benefits. And this is SSDI based off of your own work record. And the CDB one is based off a parent or guardian's record, and you can receive that into adulthood depending on your situation, but that one has slightly more rules in that if you marry someone who is not also Title II, you will lose your benefit. It's a really dumb rule that I don't understand, but if you marry someone who has a different Title II benefit, however, you get to keep your benefit. So just a little on that. I don't come across the disabled widower benefit too often because it's a very small window that you can qualify for it. And so that one doesn't come up too often. So there are lots of work incentives for Title II. I'm just going to do a basic overview of them, but keep in mind that these can be tweaked for your individual situation. It's not necessarily cut and dry like it's here. These are just the basic rules, but they can be adjusted. So with SSDI, and this goes from the date you became eligible, not the date that you started receiving the benefit. A lot of people don't know that part. They do look at your work history from the time you became eligible. So for the first 9 months you are, say, to work, you can earn as much money as you want to earn. And I'm literally talking like $1 million you could earn, and it would not affect your benefit. But this is only during this 9-month period, which isn't necessarily consecutively. It can be over a 5-year period. So like if you used 1 month and then you didn't use any again for 6 years, you would get that month back and start over again. Once you use them all up though, they are gone, and that is the end of that period. And you must earn more than $1,110 in a month to use a trial work period month. If you earn less than that, it doesn't mean anything. It just means you stay where you're at and your benefits are not affected. So that's that part. After trial work period, there is what's called EPE, and that is the extended period of eligibility. It is a 3-year period that basically safeguards your check. So if you were to make so much that they didn't give you a check that month, you would still be qualified for SSDI. So for that particular month, your check would stop. But if your earnings went back under, your check would automatically start up again during this 3-year period. And this period is consecutive. So it doesn't matter if you are working or not working or what your situation is, the 3 years will pass. So the first month that you go over, you do get a grace period check. There are 3 months of this grace period when you go over. And that would be if you go over $1,550 a month. And if it's a statutorily blind by Social Security standards, it's $2,950 a month. So quite a big difference. But these are, again, it can be tweaked to a certain person's situation. So with this, there's also what's called a subsidy, and this one's really cool. I actually do quite a few of these. So say you have a job and you need an accommodation of extra breaks, or you need help with something that you can't physically do by yourself, or you need assistance that a person in your position normally would not get. There's what's called a subsidy. And what that does is that's a percentage that is taken away from your earnings, and Social Security does not count. I actually have a person that has 100% subsidy, which means that none of their earnings are ever counted because they receive that much help. So this is just a 2-page form that an employer fills out. You send it to Social Security and they put it in. It's really simple. It's used quite frequently. And then there's the special condition. Oh, go ahead. Is there a question? No, just noise. Okay. Anyways, the special condition works similar to SSI, except this counts the whole time that you receive your benefit. This would be if you needed a job coach on site with you, and that was paid for by Save Oak Rehab. They would take the amount per hour that you are earning and times that by the hours they use, and that would be deducted from your earnings, and Social Security would not count that either. So that's if it's paid for by an outside source. The subsidy is something offered by your employer. And then there's what's called an unsuccessful work attempt. So if you go to work for less than 6 months and it just doesn't work out, you can notify Social Security through one of us, and they will call that an unsuccessful work attempt and not count it at all. None of the earnings, nothing, as long as it's less than 6 months. Because sometimes that happens, we'll take on a job that we think we can handle and turns out it's a little bit more than we can do. So that's why this work incentive exists. And then there's the same IRWI that you have for SSI. It works exactly the same way. Anything related to your disability that costs you out of pocket to work can be deducted from your earnings and not counted by Social Security. This is just a tracking chart that we use sometimes. Sometimes we'll give this to our consumers so that they can keep track of what phase they're in, how far they have to go until the next one. So it's just a helpful tool that we use. And these are ways you can save money without it affecting your benefits. ABLE is my absolute favorite. The only problem with it is you must have had your disability before the age of 26. Now, that doesn't necessarily mean the disability you have through Social Security. It does not have to be the one that's named there. It can be any type of disability as long as it was before the age of 26. And this doesn't have to be proved. You don't have to go to a doctor, nothing like that. You just tell them and they let you open the account. You can deposit $18,000 a year that is not earnings. If you have a job and you want to deposit those, it's an additional $14,580 a year. And that's up to $100,000 that Social Security will not look at or penalize you for. And you can spend this money on anything that improves your quality of life.
Now, that's a pretty broad term. And so is it really as broad as it sounds?
Yes. It really is. Also, the age will be changing in 3 years. It did finally make it through. So it'll be before the age of 46 in the next 2 years.
Cool.
Yeah,
And
that's a big one.
how far off is that change?
It's 3 years away. Because
Okay.
you know the government agreed on it, but
Yeah.
you have to wait, apparently.
Okay.
But that'll be nice. That'll be a lot better. But it does include really any disability. So, you know, you don't even necessarily have to have had care for it or specific, you know. It's very broad.
So if you're a person with a disability and working, you could save what, $32,580 a year then?
Yes,
And Social Security won't count that as an asset against you.
right.
And is that also the same with Medicaid, Medicare benefits?
Yes.
Wow.
It blocks it from anything, basically.
Okay. So that is like, I don't know if you want to call it a loophole, but a way for a person with a disability to actually have some assets that are not gonna kick them off services.
Yes, it's great. Also, they have the option of investing. It's not just a savings account. You have the option of a savings account. You have the option of low threshold investment or high threshold investment. So you can even make money off your money and not be penalized for it.
Okay, and so for people interested in an ABLE account, what is the best way for someone to find out more information or to apply for one?
You can just go online. They have a website. It's Oregon ABLE, and it's pretty easy sign up process that you just do online. You do have to have a bank account to connect to it in order to fund it. You can request a card to use, or you can just have funds moved to your bank account. Most people go with the card though, because it's a little dicey with moving money to your bank account. The Social Security does look at. So that's a little bit of a gray area there. I would be cautious about letting your account get over the amount that you're allowed to do.
And now so how would that work with money going into your normal account and then you move it over? Or would you just switch like a direct deposit into your ABLE account?
There is a way to do a direct deposit from account to account. Other people can actually put money into your account also, but it's
Gotcha.
mostly done through a bank to another bank, to them is basically how that works. But you can request an ATM card and then it works basically like a debit card.
Okay, and Kirsty, could you drop the link to the Able account in the chat when you have time? And then Leslie, here's the question for people that are over that receive their disability after the age of 26. What options are there for them?
Well, there is what's called a special needs trust. That one is a lot more restrictive, but it does allow you, I'm not even sure there is a cap on that for what you can save, but it's very specific. It has to be like for your disability, kind of. It's not just a free for all, you can spend it on anything. There's also what's called a pass, and that's for someone who, say, is eligible for SSI and has enough earnings that they could live on without that SSI. And they will allow you to set aside your entire SSI check to save money, but it has to be for a specific goal. Like if you're trying to buy a house or you're trying to buy a car, and it has to be approved by Social Security. So it's a little bit difficult to set up. That's the other problem with the special needs trust. It's kind of expensive to set up in the first place, and it requires specialized people to do it. We can walk you through that process, but we don't actually set up that account. And with the pass, like Social Security has to make that final call whether you can do it or not. And other than that, there really isn't anything else yet. These are the different sills across the state, and we have WICs at each sill. Work incentive coordinators like us. So if you know people close to these areas that would prefer more in person, these are the locations that we're at, and they serve all the counties in their immediate area like we do. We have like 4 counties in the Southern Oregon area, and they serve the rest. That's really about it as far as the overview goes, but I'm open to any questions anyone has.
I have a question about the sills. So there's 6 of them covering the whole state.
Yes.
Okay, and the work incentives benefit coordinators, there's 11 of them throughout the state.
Yes.
Okay, awesome.
Leslie,
Yes.
would there be any way that we could get a copy of your PowerPoint? It's so rich with information.
Sure. We did send it to Casey. I don't know if you want to send that out to people that want it. Oh, never mind. We're going to send you an updated one first, Casey. Don't send that out.
Okay, I'll drop my email in the chat, and anybody interested in receiving a copy of this PowerPoint, you can send me an email and I'll make sure you get a copy of it.
And if you have any questions, you can always email or call us as well. If it's too much for us to answer, then we can send you to the right people.
Are you still taking questions now, or are we through?
Yeah, no, go ahead.
Yeah, it's open.
Yeah, I'm
So
open.
if someone goes on and off SSDI, right?
Mhm.
And goes back to work, but makes significantly less before they went on to SSDI. Can that, like, and they work for a few years, can that bring down the amount of Social Security you get every month? Like, because it will lower your average because you were working at a higher rate and then got off, worked at a low rate. Will those average in to drop
No,
your retirement?
no, I don't believe that would happen. No.
And the second related question, is there at some point in your 60s that SSDI, excuse me, converts to just regular retirement, Social Security, and you could go by those rules?
Yes. Depending on your birth year, when you hit full retirement age, I mean, you can take it beforehand, but you'll get a lesser amount and that amount will never go up. So we always recommend to people to wait until you're of full retirement age, because then you can make as much money as you want to and still receive your benefit.
And so
the rules are totally different.
You could apply for Social Security basically when you're on SSDI. Is that what
It
you're
would
saying?
automatically switch.
Oh, it will.
Yes,
Okay, but as a male, it's probably gonna be when I'm 67, right? Full retirement, or it's
that's,
not 62 or 65.
no, those would be the earlier stages, and they just take part of your benefit for you taking it early. And then there are still work rules that apply to those, but waiting till full retirement, if possible, is always better.
Thank you.
Mm-hmm.
And Leslie, thank you for doing this PowerPoint for us. I appreciate it. And thank you, Casey. But I totally spaced it, so I was here late. So it's probably like a redundant question I'm going to ask you right now. But
Okay.
because I didn't get the whole spiel, I'll probably end up getting it from Casey anyways. But it just, so I heard that once if you do start working, obviously it'll start taking from your SSDI. And then does it also start getting into like your caregiving hours as well? Like would they stop taking those hours from you too? And then little by little, then you got to pay for your own caregiving hours? Is that how that works? Or do I have that all wrong?
No, SSDI is also an all or nothing benefit, so they don't take portions of it unless you have like an overpayment situation. And as far as the medical benefits goes, that's where it gets personal to you in how that works. So there's different rules for Medicare versus Medicaid. Depends on whether you have SSI Medicaid. There are 5 or 6 different types of Medicaid that all work differently. So that would be personal to your situation, but they wouldn't just take hours gradually. You would either have your medical benefit or you wouldn't. There wouldn't be a middle ground.
Leslie, I think you missed the part about the EPD program. So if you could just give
Okay.
a quick overview of how that works for them, I think that'd be helpful.
Okay, so if you get to the point where your Medicaid is in danger, or you have SSI Medicaid and you go over that threshold, there is what's called employed persons with disabilities, and you can buy into that. Could you bring that slide back up?
Thank you.
Yeah, no problem. This is not it. EPD. Yep. Sorry.
Oh, back, there you go.
There we go. So EPD is for if you go over the threshold or you are earning too much income for one of the other Medicaids, you can buy into EPD, which will keep your Medicaid intact and allow you to keep your hours and your outside things that you need. And
So-
that, we believe that goes up to almost $6,000 a month. And even then there could be other protections for you individually. It's personalized.
So Marvin, you see where it says monthly countable income at the bottom in the orange?
Yes, I see the orange. I see, okay, monthly. Yeah, I see that.
So those rates, like if you were earning under 850 a month, you'd have a $0 fee to keep your Medicaid benefits that pays for your care hours. And then so you see each one is the earnings and what your buy-in would be to keep your Medicaid benefits that covers your care hours. So you see at the bottom, you could earn $2,832 and up to, what was the number, Leslie?
Just under 6,000. I don't
So-
have the exact figure in front of me.
If you earned it somewhere in between those two, you'd buy in for $150 a month to be able to keep your Medicaid benefits, which covers your care hours.
Correct.
That's not a bad deal. Actually.
Certain Medicaid actually can switch to EBT with a 0 participant fee, even if you earn more than that. But that's for specific types of Medicaid.
Okay, so my question is, how come they allow you to work? I was kind of I always figured that because they let you work for a full year or like 9 months. You were saying something like that. You can make as much money as you want. Is that like a trial to see how much money you could make? And then like, look, we have proof that you work for this much and you could make this much money. So, you know, why do we do that? Why only a full year that you could work without getting any, as much money as you want or make?
That's just to give you a chance to try out working to see if you wanted to work 40 hours, for instance, because there are work incentives to keep your medical depending on your situation. So that does not work against you at all. And if, say, you are working with Voc Rehab, for instance, or one of those types of agencies, an employment network, there's what's called the Ticket to Work program. We actually don't have that on here somehow. But when you have that network or Voc Rehab put your ticket to work in play, so to speak, it protects you from any medical reviews from Social Security while you have that ticket in play.
So what happens with the tickets not to play anymore? Then what happens after that?
Well, it would be way past that 9 months. So you would determine if you could work full time and then would have to look into work incentives that apply to you specifically. But like me, for instance, I work 40 hours a week. And I still receive my Medicaid.
Okay.
Yep. For me, for instance, I work 30 hours a week and still receive my Medicaid and my care hours.
And so do you lose your for 30 hours, do you lose your SSDI though?
It's
Depends.
but yes.
You
Right.
could, it depends on your situation.
Yeah, it's very situational, but the answer to that is yes, you very well could. And or you may only keep a portion of it.
For SSDI, it's not a portion, you'd get all or nothing.
Gotcha.
Yep, SSI deducts $1 for every $2 you make, but SSDI is all or nothing.
Mm. Thank you, Leslie.
Of course.
Leslie, is there, oh, can you hear me?
Yes.
Oh, good. Is there a time limit on the, TWP stuff? I used my TWP like 25 years ago.
Did you use
Just-
all 9 months?
Over the course of a couple of years, yeah.
Okay, so they are all gone.
But yeah.
Yeah,
just-
you don't
just-
get them back. The only way you would get them back is if you worked off of your benefit and did the expedited reinstatement. And after a certain time period, they would give you back all of these phases.
Okay,
But yeah,
thanks, then.
they're gone, unfortunately.
No problem.
Yep.
Anybody that has questions, you can feel free to unmute and ask them. I think I saw one in chat too. Give me one sec.
Yeah, I was just looking at that. Ticket to work. So for the ticket to work question that's in the chat, there is no income limit on that.
And I saw a couple people requesting copies of this PowerPoint. And what I'll do is I'll just look at the registration and everybody on here. I will send the links from the chat and also a copy of the PowerPoint.
Okay, we'll send you this updated one because yours looks a little different.
Yep, perfect. Another question that I've received from clients is for clients that got injured earlier in life before they had a chance to work that end up on SSI. It seems like there's more restrictions and they have a harder time, especially if they get married later, then their spouse's income kind of counts against them. But I've heard something about if you're on SSI and then work long enough to gain enough points or however that system works, then you can switch over to SSDI.
That is correct. You can get, I'm earning work credits now. I probably have another 10 years of work because of my age before I qualify for SSDI. But if you're, say, in your younger years and you were injured, say, when you're 22, but you were able to work for a few years after that, it wouldn't take very long before you had enough credits for SSDI. So the younger you are, the less time it takes.
Gotcha.
Like for me, I believe I need almost full retirement credits because I didn't start until my 40s. So that makes it a little harder, but yeah, I wasn't aware it was that easy, but apparently it is. And the income that you need to make to earn those credits is also like 1,000 something a month. It's not even a very big number. So
Got you. And
yeah, my daughter over here is halfway there. If something were to happen, she could qualify for SSDI in just a few years.
yeah, so I broke my neck at the age of 20, and I had been working since I was 16, and I did qualify for SSDI just in that 4 years of working. I guess
Yeah.
because I had my injury young, but
Yep.
and then I don't know if you're able to elaborate is there benefits from switching if you did do that from switching from SSI to SSDI?
There is, it depends on if the Medicaid is a needed benefit, because that can come with you even if you have SSDI, as I'm sure you know. I'm guessing that you have both Medicare and Medicaid.
Yeah, I'm dual covered. Yes, Medicare. Medicaid.
Okay, and that's partly because you were SSI before. So that Medicaid comes with you, which is really good. So in that case, the benefits are that you don't lose money like with SSI. For every 2 you make, they take 1. So it's really easy to lose your check real quick. But the thing is, you're still ahead in amount of money that you have. And that part's really hard to get through clearly to people because some are very concerned about losing that SSI.
Yeah.
But, you know, unless you're making quite a bit of money, the Medicaid's not going to go anywhere. So for me, I'm glad that I have just SSI because I don't have to worry about the phases and things like that. I can just continue to work at this level indefinitely and keep my Medicaid. So, but see, the thing is, Social Security will make you switch from SSI to SSDI because SSI is needs-based, because you can also receive SSI if you don't have a disability. So they will force you to switch from one to the other.
Another thought I've had just from clients I've worked with, there's a lot of let's call it fear around like working and loss of benefits and loss of SSI or loss of SSDI. And
Yeah.
I mean, you're more of a professional at this, but I try to explain that like I know it's scary of losing SSI, but also if you're working and making more than your SSI check was, that there's benefits to that, especially if you're enrolled in one of these programs that protects you. So if something happened and let's say it's like you decided like I've tried this for 2 years and it's too hard on my body, I can't continue working, I need to go back to my SSI. And so do you have any advice for people that are kind of like on the fence or kind of scared about pursuing that?
I was on that same fence, actually. I didn't work for a number of years because I was so scared of losing my benefits. We found other ways to survive. My husband also couldn't work. A few times we, tried to escape the system, go around it, and hope they didn't notice. That bit me every time, and I ended up with an overpayment. I don't suggest you do that because that did not work out. But honestly, there's so much protection there. It's worth trying. I mean, it really is worth the effort. To go from $943 to $3,000 a month has been huge for my family. So it was well worth the risk. And I know that safety net is still there, especially since I'm still SSI eligible. I have not gone over to the point that I'm off. As soon as I enter EPD phase, I will no longer be SSI eligible. But that's a good thing because it opens up my husband to work. For the first time in our 30 years of being together, he can get a regular job. So, it's scary, but a lot of things in life are scary, but it's worth the try. And you can always come to one of us if something happens, even if you end up in an overpayment situation. Those are kind of scary. And that's just basically when they pay you when they shouldn't be, and then they want their money back. But there's things we can do. There's ways to help. And I just really advocate for giving it that shot. Because what's the worst case scenario? You can't do it and you end up back on SSI. That's where you started. So, there's really not as big a risk as people think. It's easier to get back on those benefits than Social Security would have you believe.
Thank you.
Yeah, it's a really mixed message they give. They're like, go to work and get off SSI, but don't work or we're gonna take it. They like put the fear
So
in people.
I have a question.
Uh-huh.
Casey kind of tapped into it a little bit. So the reason I'm in this meeting is because my son is turning 18 this year.
Uh-huh.
And so I'm getting into that preemptive. So he's been disabled since he was 8. And what I'm trying to figure out is all the information you've been sharing a lot about employment and SSI and switching between them, going on and off. How do you keep Medicaid during all of that? Or is there a way to do that? Or is this the wrong meeting for it?
How do you keep Medicaid while what is going on?
Well, if say he gets a job and he's on SSI and has Medicaid and stuff and then starts making too much and is off SSI, does he lose the Medicaid?
No. That's where I'm at. I make at least 3,000 a month, sometimes more. And I still receive my Medicaid. This is the work incentive that we're showing right here on the screen. Also, if he is under the age of 22, there is the other work incentive that allows him to keep his SSI in work. And make, what is it,
Right, I saw that.
2,000? Yeah.
Mhm.
So the Medicaid does stay intact, all the way up until 42,955. And then if they go over that, you can buy into Medicaid to keep it.
So I do want him to apply for SSI before he turns 18 for the Medicaid benefits.
Before he turns 18?
Or do I need to do it before he turns 18?
You can, but he will have to change it when he turns 18.
Okay, so I could wait till after.
Yes. And then it will be
Okay.
solely his benefit at that point. So his money would affect it. He would become a separate household of his own.
Okay, because currently he's on OHP, so he would be switching from OHP to Medicaid, or would that have
OHP
two
is
insurance?
Medicaid.
Okay.
They're one and the same.
Okay, that's what I thought.
Does he get OHP because he's a child or because he has a disability? Do you know what type?
No, we don't even really have him on there as disabled. It was just because of our income when we moved to Oregon. So all my
Oh,
kids
okay.
were on it.
Okay, yeah, that would change when SSI, because it's SSI Medicaid, so it's a different box. Yeah, so the income limits change drastically for SSI.
Okay.
They go up
Okay.
quite a bit. It is worth doing if you expect them to be employed as well. It's easier to keep the Medicaid benefit this way than it is to just have the Medicaid benefit, because then you're more restricted on your income limits.
Okay, perfect. Thank you.
Uh-huh.
Lizzie, what if you want to start a business? How does that work?
You
You
can
don't-
start a business. There's just a different way to track the earnings. And we didn't really go into that much, but there are work incentives for starting a business as well. That PASS program to save money can also be used to start a business. They just, instead of counting your income monthly, they would count it yearly. So if, say, you made 3,000 one month and you made nothing the next month, it would even them out. So that would be the difference. And there's also some business work incentives that go along with self-employment. So that would be a very personalized conversation, but it can be done. I do have people that I work with that are self-employed and doing quite well.
Yeah, because what if that year you don't make nothing, you lost money that year? How does that work? I mean, obviously, well, I don't know.
It wouldn't affect your benefit.
Okay.
I mean, it'd affect your business, but your benefit would be okay.
Okay, cool. I was wondering. Okay, cool. Thank you.
But if that's something you want to look into, you can reach out to one of us or reach out to the WIN Help Desk and then give you more information. Because I really didn't touch on that tonight because it's very involved and it's very specific.
Yeah, because I mean, the way I see it, a lot of the people, like especially my sisters, like they just tell people what to do, and like you just gotta find something, and you gotta find somebody to do it for you, and all you have to do is just tell people hey, this person, all you gotta be in the phone, and it's just a matter of finding out what You could talk to
Mhm.
people and, hey, dude, I got a job for you if you want to go do it for this much, and then that way you make money out of it.
Right.
But you just gotta find somebody that does a job. And you're just the person in the middle. I just want to be the person in the middle. That's it.
Yep, I hear you.
Yeah. Anyways, thank you.
Yep.
Leslie, another question I get a lot from some of the clients are for people that are on SSI that have gotten married and then
Mhm.
they're collecting SSI benefits, their spouse wants to work. Like, what kind of protections are there or anything in there for that kind of situation?
There isn't any. Unfortunately, Social Security hasn't caught up with real life yet. And there's no protection from that, which is why we struggled for so many years. But the person receiving the benefits has these work incentives, but it doesn't work for the spouse, which is unfortunate because then a lot of people just don't want to get married.
Yeah.
But the problem is with Social Security is if they think you're showing as married, living together, people treat you as if you're married, they can actually penalize you for that. So it's a very dicey area. But unfortunately, yeah, there's no protection from that. A spouse can make very little before it
Huh.
affects.
Such a shame because it puts
It
this,
is.
it puts this stigmatism on like getting married to people with a disability or somebody with a disability, like, oh, we can't get married, it just hopefully
Yeah.
the system catches up.
Luckily, I was too young to realize that. I married at 18 and I had no idea that it would affect me that way until the first time we had to go to Social Security and they were like, hey, he works. Guess what? You get nothing. I'm like, wait, what? Hold on, try that again. So, we had to find ways around it is as far as I'm going to elaborate. But we managed to make it work until I realized I could work. And that, made a lot more sense for our family. So
Yeah,
he did a lot of the raising of our kids while I worked.
very cool.
So
Yeah.
you're saying to get divorced if you're in this, if you're married, get divorced, or else you just get your benefits taken away. Would that be a better solution for that?
If you divorce, you're also going to have to separate. Like they will not just take a divorce decree if you're still living together or still. It's a pretty dicey situation. I wish I had better news about that, but
I don't have to worry about it. I'm just trying to kind of go around this. How could okay, well, I guess I'll get divorced and she's not my wife anymore. Check it out. Here's a paperwork. Like, okay, no. So then you
Yeah.
to have separate homes. Okay.
They'll actually go as far as to get a hold of people that you know or your neighbors if they think that you are trying to defraud them.
Wow, man.
Yeah, it's bad. It's really bad. That's something that really needs to change.
Yeah, I would say so. Yeah.
Yeah, I mean, everything about SSI needs to change in some ways, like that $2,000 resource limit has been the same since the 80s. Like everything else goes up, but that never does. It's just insane. They are pushing to move it to 10,000. There is a group of people working to push that through, but so far that has not happened.
Hey, John, are you still here? Maybe. West, are you here?
Yes, I'm here.
Hey, do you mind elaborating just a little bit on the Disability Health and Employment Equity Coalition and the Senate bill that we're trying to pass?
Oh,
Or John,
Yeah,
John, do you mind one of the two of you?
Wes, you want me to talk?
yeah, you go.
So there's a coalition of organizations from around the state that are proposing the employed persons with disability programs eliminate the income and the resource limits for that benefit, that program. That's the program where if you want to keep your Medicaid health and your Medicaid long-term care benefits, you can get into that, enroll in that program, subject to limits, and it's the subject to limits that this group is trying to remove. Our sister state to the north, Washington, removed those limits years ago, and so we're going to try and do the same thing. In Oregon, we can use your help, though, because our legislators need to be convinced that it's something worth investing. So if you want to, my email is in the chat, and you can just copy and paste that, shoot me a quick little hello kind of an email, and I'll put you to work and hopefully acquaint you with your legislators so that you can have conversation.
I'd love to hear more about that. I'd love to get involved.
We will be having a statewide coalition meeting, and so I can go ahead and give forward that invite to you and Casey, and perhaps you can spread it around this group.
I'd
Yeah,
be
no,
happy to spread it around.
you send that to me and I'll share it out with the slideshow and all the other good information that's been shared in the chat with everybody.
Did you include me even though I have all the other information?
Yeah, I'll include you. I'll just leave out the slideshow.
Thank you.
John and Wes, thank you both for all the hard work you guys have put in to the Disability Health and Employment Equity Coalition. It's such an important topic and such an important bill that you guys have been championing. So thank you.
Yes.
Well, it takes a team, and we'd welcome more players. So just shoot me a mail, and I'll hopefully get you to work on the team, put you up to bat.
I could probably bring you quite a few.
Oh, wonderful. Thanks.
Yeah.
You know, it's not often that we have somebody that's such an expert on this topic in the room. So if there's any more questions, like, don't hold back. Please feel free to put them in chat or unmute and ask them.
And if I don't know the answer, I could get the answer.
Hi, this is Chris.
Mhm.
I'd like to, could you expound a little bit more on Ticket to Work? I know it wasn't in your slides. I'd like to know like how that works and the income limits on it. And I was thinking that might be a good fit for me. I just kind of wanted to hear a little bit more about it.
The Ticket to Work, there are no income limits that I'm aware of. So what happens is you have to be working with an employment network or vocational rehabilitation, places like that. We can help you with finding an employment network in your area if you do not want to use Voc Rehab. A lot of people don't. But they put your ticket into play to protect you from medical reviews from Social Security while you're feeling out how to work, where to work, how much to work, those kind of things. So it doesn't last a long time. It just kind of depends on your situation. For some people, they're done with their ticket pretty quickly. Other people might keep it for a couple of years. It just kind of depends. That's personalized to you.
Gotcha.
But it does protect you from that medical review, which is how a lot of people lose their benefits, because they're like, oh, you can work above SGA, which means, you know, you're rehabilitated to some point in their mind. So it's nice to have that protection. You would still get work reviews, but those are easier to manage than medical reviews.
Right. Okay. So I'm on SSDI.
Okay.
And so another question would be, so on the SGA it's 1550, correct?
Right.
And so if I stay under that, if let's say I have a salary that's under that, then it doesn't affect my Social Security disability at all.
Right.
If I am reading that correctly. And do I have to report it, but I don't have to have a ticket to work. I just have to report it to
Right.
Social Security.
Right.
Okay.
Because if
Okay,
you're
so
under SGA, they can't say that you're medically cured anyway.
Gotcha. Okay.
So you wouldn't need the ticket. But that's after that first 9 months.
Oh, that's after the first 9 months. But if I just start and I keep it under, I don't ever have to worry about it, or?
Yeah, you can stay in the phase of not even trial work period forever if you wanted to.
Gotcha. Yeah. Okay. We have a family business, and I'm just trying to figure out where I fit. So. Okay.
And
thank you.
And remember, there are work incentives. So if you did something that wasn't a job that another person would do, because sometimes employers will, especially in family business situations, they will give you certain jobs that you are able to do that are specialized to you. So that can reduce the amount of income that's actually counted. So that would be worth talking to a work incentive coordinator about.
Gotcha. If I was up and over the SGA.
Yeah, even if you were up and over SGA, it would be fine.
Yeah. Copy.
If you had one of those things that we could utilize.
Okay. I think that answers my questions. Thank you.
Okay.
Yeah, Chris, I would recommend getting an appointment with a wage benefit counselor and really kind of going into your specifics and get it like a tailor-made personal plan for yourself.
Okay.
Right. If it's a family business, that would be considered self-employment, and that's a whole nother ballgame.
But I'm not an owner.
Okay, yeah.
Yeah.
It would just kind of depend.
Gotcha.
Yeah. We
Copy.
could talk
All
about
right.
it more.
All right. Thank you.
Mm-hmm.
Do we have any other questions out there?
And if you think of any, you're always welcome to call or email one of us.
Yeah, and Leslie, when I send out the email to everybody, I'll make sure to include your contact email in there for anybody that's
Okay. It's also at the end of this PowerPoint, both of our emails and phone number.
If we could go back to that last slide for a sec. Thank you, Kirsty. All right, last call for any questions. All right, not hearing any. I just want to say thank you, Leslie. Thank you, Kirsty. This has been like such a needed educational forum. This information is just not out there. So we really, really appreciate your time and the work that you guys are doing with this program. So thank you, thank you.
Of course, and thank you for having us.
Absolutely, yes. And maybe we could do something like this again in the future in person, maybe an in-person group training on this.
I'd love to do that. If anybody knows anyone else or any organization that might benefit from this information, feel free to have them reach out to me, or you can reach out to me. And
definitely, and yes, going forward, we at Oregon Spinal Cord Injury Connection and our CHW team will definitely be referring clients out to this program now.
okay.
Awesome. Well, thank you everyone for attending. We really appreciate it, and we'll see you at the next Ed Forum.
All right. Thank you, Casey. And thank you, everybody, for coming.
Thank you.
Thank you all.
Bye, Other Me.
Thank you. Good night.